It is 8:43. Welcome back. October is Breast Cancer Awareness Month, and many local doctors across the area are working to give people impacted, especially those young women, resources for their fight.
Co-director of the Sandra Levine Young Women's Breast Cancer Program is Dr. Lejla Hadzikadic Gusic. Joining us, and Dr. H, thank you for your time this morning. We appreciate it.
Absolutely. Thank you for allowing me to be here.
So let's talk about especially the younger generation of women. Are there studies and results out there that show that younger women are being diagnosed with breast cancer than maybe a decade or 2 decades previous?
Yes, absolutely. So about 6 to 7% of all breast cancer diagnoses are in women under the age of 40. And so that's a significant amount when you look at the population of women in the United States, for example. And it's not necessarily that they're being diagnosed more, it's just that we're finding it a lot more. We're doing mammograms a lot more. Thankfully, the word is out more. So now we're just unfortunately seeing it a lot more on the clinical side here.
And you're the co-director of the Young Women's Breast Cancer Program. What makes this program unique and really one of a kind across the Southeast?
It's actually one of 4 programs in the country, which we're incredibly fortunate to have one here. It was a program very generously funded by the Levine family, and it was named after Mrs. Sandra Levine. In 2017 is when it started. So it really is a program looking at the needs of women under the age of 40, and it was actually recently expanded to the age of 45. But we know that those women have different needs. They have young children at home. We have to sort of see what different support needs that they have. And we also do want to focus a significant part of this program on research. Majority of what we know about breast cancer was based on historic randomized controlled trials from the 1970s and 80s that unfortunately can't be reproduced in this population because you just need sheer larger numbers. So we extrapolate a lot of data from those studies to this population, but we do know that we need further research, and part of this program is hoping to establish that research in younger women so that we know that, is their biology different? Should we be treating them differently? So that's a huge part of this program as well.
And Dr. H, although every patient is completely different based on their makeup, how does the program step in? Let's say that a woman is diagnosed with breast cancer. From the moment that diagnosis is given out, obviously there's probably the mental toll of dealing with that diagnosis just on a mental level of how to process that. But how does the program step in and go, okay, from here, we're going to take off. We're going to be alongside you through the whole journey. How do you go alongside a woman through this process?
Sure. So when a woman comes in, she's assigned a navigator, a nurse navigator, who essentially sort of really helps her navigate the way through this entire path. And part of that, they get materials from the Young Women's Program, which are things like essentially support groups that are geared towards their age and typically virtual to help them so that, if again they have work issues, childcare issues, they can still participate in these. We're actually working on a mobile app that they can communicate with each other to try to help at odd times that you're not going to be able to reach out to somebody, but we wanted to have a local group that they can talk to. From a clinical side, we make sure that any clinical trials they are available for that they know that. We make sure that their treatment focuses on things like genetic testing, like fertility, interest in more children, and that is all worked into their treatment. And so that's kind of how we particularly focus it to younger women. And then essentially they're taken through their treatment. We already have an excellent breast cancer center at the Levine Cancer Institute, but we just hone in some of the treatments, particularly more to their age and some of the opportunities they have for clinical trials and for support.
When and how often should women be screened and having this conversation with their doctors?
I mean, we still really hold that they should start at 40 with an annual screening mammogram, and that they should start doing physical exams really at starting at the age of 18. There's really no reason not to be able to start doing physical exam and to letting somebody know if you feel something. It should be taken seriously. No one should be told, oh, that's nothing. It's probably a cyst. You're too young. That shouldn't be something that is said to any young woman who feels an abnormality in her breast. That needs to be taken for imaging, for ultrasound, mammogram, possible biopsy, and that's really irrespective of age. But it's really 40 annually. And then we do talk to women who do have a very strong family history to consider starting earlier or start getting increased surveillance if you have a stronger family history.
Dr. H, we appreciate your time. There is some more information, just some breast cancer statistics, which we will be talking about and highlighting throughout the month of October. We thank you for what you're doing at the Sandra Levine Young Women's Breast Cancer Program. We are very fortunate that we do have one of those here in our area. Thanks for your time today.
Thank you very much. Have a great day.
You too. Coming up on 8:49, time to get a check.